Hi, my name is Kat. I will be your nurse today. I'm just a student, so I'll just be going over everything that I have on my chart here. We'll be doing a full body relaxing checkup and a detailed neurological examination. Can I start off with your first and last name?
Shayna Owens.
Your date of birth?
March 28th, 87.
What did you have for supper last night?
I had sushi.
And what day is today?
Friday, April 15th.
Okay. Alright, we'll be starting off with vitals. I'll be putting some sanitizer on my hands, putting my gloves on, and we'll get started.
Okay.
Has your weight fluctuated in the last 6 months?
No, just lost a few pounds. I'm pretty active, so that's to be expected, I think.
That's awesome. It's always good and healthy to be active. And anything to be concerned of today?
No, but I did hit my hand on the corner of my dresser and I got a small little blood clot there.
Oh, wow, I'm so sorry about that. We will definitely take a look at that. I'm so sorry. All right, so starting off with your vitals, we're gonna go with your temperature. I'm just gonna put this on your head and go behind your ear. Okay, your temperature is 97.5, which is normal. Next, we'll be checking your oxygen. I'll just be counting to 5. 1, 2, 3, 4, 5. All right, your oxygen is 97, which is great, and your pulse was 70 beats per minute. I do want to check the pulse bilaterally. If you could just put your arms up, and I'm going to just check for your pulse here to make sure that it matches. Perfect. Alrighty. So the beginning of this assessment is just going over the cranial nerve exams. And so we've got 12 cranial nerves in the facial area. We're going to start off with cranial nerve number 1, which is the olfactory nerve, and that is smell. And so I'm going to have you just smell this for me and tell me what that smells like.
Strawberries.
Wonderful. Good job. Try one more here.
Blueberries.
Great. Perfect. Alright, so you did well on that nerve, which is awesome. The second one is a optic nerve test. That is where I'm going to have you look at the Snellen chart, but I'm going to have you close one of your eyes using this.
Okay.
And then I will have you tell me which one I'm pointing to, okay?
Okay.
Okay, so we'll start off with this letter over here.
E. D.
What number?
4.
Can you read this line?
F. E. L. O. P. Z. D.
Can you read the bottom line backwards?
D. T. F. C. L. O. Z. E. P.
Perfect. And what color is this?
Green.
And what color is this?
Red.
And this number here?
1.
Awesome. Thank you so much. I'll have you cover your other eye. What letter is this?
P.
And this?
D.
And this?
F.
And this?
Z.
Can you read the bottom line backwards, please?
D. T. F. C. L. O. Z. E. P.
And this number here?
8.
This number here?
3.
And does this look red to you?
Yes.
Does this appear green to you?
Yes.
Awesome. Thank you so much. The next cranial nerve is Ocular Motor, which is the third cranial nerve. And I'm going to have you just blink for me. Perfect. Look to the left, look to the right, and look up and look down. Okay. While I'm doing this, I'm also going to be assessing your cranial nerve 3, 4, and 6, okay?
Okay.
So what I'm going to have you do is just not allow me to open your eyes. So I want you to close your eyes. Good. Perfect. All right. So now what I'm going to have you do is just follow the ball of my pen with your eyes. Good. Okay, good. Awesome. And your nose. All right, I will be doing a finger wiggling assessment. So I'm going to be wiggling my fingers. I want you to look at my nose and tell me which fingers are moving, okay?
Okay. Your left fingers.
Okay.
Right. Left. Right. right, left.
Awesome. Now I'm going to have you do the same thing. Look at my nose. Tell me when you can see my fingers coming into your vision.
I see them.
Good.
I see them.
Okay.
I see them.
Perfect. Thank you so much. So your eyes are intact, which is amazing. Cranial 3, 4, and 6. Perfect. Now we are going to be testing your trigeminal facial sensation, your trigeminal nerve on your face.
Okay.
I'll be doing a sharp or dull test on your face. So what I'll have you do is just close your eyes. And then I would like for you to tell me if this is sharp or dull on your face. And this is what dull would feel like. And this is what sharp would feel like, okay?
Mm-hmm. Dull. 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 Sharp. Sharp. Dull. Sharp.
Perfect. Now if you could just tell me really quick where you feel this. You don't have to tell me if it's sharp or dull, just where you feel it.
Forehead. Nose. Cheek. Cheek. Chin.
Great. So cranial nerve 5 is intact. Alright, so we'll be testing cranial nerve number 7 now, and that'll be your facial muscles. So I'm going to have you just open your mouth, okay, and close your mouth. Perfect. And I'll have you smile, frown. So next we'll be checking your auditory cranial nerve, which is your ears.
Okay.
And so I'm going to have you just close your eyes and tell me which ear you hear this sound.
Left. Right. Left.
Do you hear this in front of you?
Yes.
Do you hear this above you?
Mm-hmm.
Do you hear this below you?
Mm-hmm.
Wonderful. I'm going to just have you stay with your eyes closed. And I want you to just tell me when you cannot hear this sound anymore, and this is what it's going to sound like. Okay?
Okay.
All right.
Right. Right.
Awesome. Thank you for that. You can open your eyes. So the next one is taste, cranial nerve number 9. So I'm going to have you just stick out your tongue and let me know what this tastes like.
Lemon.
Great.
Mm-hmm.
Cranial 9 is intact. Awesome. So cranial nerve number 10 is the vagus, which is me just checking to see if your uvula is intact.
Okay.
So what I'm actually going to do is use one of these. And I'm also going to check your gag reflex at the same time.
Okay.
Don't worry, I won't just, stuff this down your throat, but just checking. So if you could just open your mouth, tongue down, checking your mouth. Okay, perfect. And the gag reflex. There we go. Good. All right, that was perfect. So your uvula is intact, which is wonderful. Okay, and then cranial nerve number 11 is the accessory, and this is with your shoulders. So what I'm going to have you do is just shrug your shoulders. Perfect. Now hold your shoulders up. Don't let me push down. Wonderful. Thank you for that. And cranial nerve number 12 is hypoglossal, which is tongue movement. We sort of already looked at that, but I'm just going to have you stick your tongue out, move it back and forth, up and down. Wonderful. Thank you so much. That is great. All right, so we're going to move on to checking your eyes with my light. If at any time it becomes uncomfortable, please do let me know, okay?
Okay.
I'll be using my device here. Do you have contacts in right now?
No.
Okay, perfect. So first thing I'll be doing is checking for perla, which is your pupils, if they're equal, round, reactive to light and accommodation.
Okay.
So I'll have you look just straight over there. Looks good. I'm just checking your eyelashes. They look great. No dryness around your eye, which is amazing. I'm going to come just a little bit closer and look at your optic nerve. So I'm just going to pull down a little bit, look at your optic nerve. Okay, optic nerve is intact. I am seeing the veins, which is good, and eyelashes once again look great. Closer up. Perfect. I'm gonna look at your other eye now.
Okay.
So I'm gonna have you just face this way. I'm gonna come this way. I'm just gonna take a look at your eye just from here, looking at the eyelashes. They look great. Your skin is not dry around your eyes. Okay, so this eye looks really good.
Okay.
I'll just be writing that down.
Okay.
Next, I'll be checking for anisakura, which is unequal pupil distribution. I don't believe you have it, but we'll take a really quick look anyway. I'll have you just look at my nose. Okay, so the right one is about 2 centimeters, which is perfect. And the left, which is the same thing. That is awesome. Okay, and one more time. Good. All right, so we've got no anisakura going on, which is awesome. And I'm going to be looking for strabismus as well. It's a disorder in which both eyes do not line up in the same direction.
Okay.
So I'm going to have you just follow the light with your eyes. They're both following. Great. Up and down. Great. Okay, perfect. So that's looking good. I'm just going to write that down for my notes. I am going to now move on to palpating the head, the face, and we're going to go down to your thyroid.
Okay.
So, I'm going to start off by just feeling your head for pain.
Okay.
And your neck, behind the head. Do you feel any pain there? No?
Mm-mm.
Now I'm going to start off by feeling your ears for any pain. Okay. I'm just going to feel the mastoid process here at the back of your head, looking for any bumps or lesions. No pain. Okay. I'm going to use my light to look at the mastoid process really quick just to see if there's anything back there that we need to be concerned of, which there isn't. And once again, skin is soft and moist. Now I'm going to tap on the frontal bone, which is your forehead.
Okay.
I'm going to just feel it and let me know if you feel anything, any pain. Okay, I'm just going to tap. Okay, and I'm going to move down to your malar bone, which is your cheekbone.
Okay.
I'm going to also feel your sinuses at the same time. Let me know if it hurts, okay?
Okay.
Okay, looks good, and no abnormal bumps. Perfect. Now I'll move on to your trachea to see if it is midline.
Okay.
So if you could just look up for me, palpating the trachea. Does that hurt at all?
Mm-mm.
Okay. The trachea is midline, which is wonderful. The next thing I'm going to do is look for jugular vein distension to see if your vein is popping out when you are turning your head.
Okay.
So I'm going to have you just tilt your head back and land it on my hand. Okay, and I'm just looking for jugular vein distension. I do not see the vein, which is great. We'll move on to this side here. Looking for jugular vein distension. And actually, could you move your face to the right, please? Okay, we do not see jugular vein distension, which is great. Down. Okay, now I'm going to check the pulse of your carotid artery.
Okay.
Or just the strength of it, actually.
Okay.
So I'm just going to put my 2 fingers here. That is 2+, and 2 fingers here. And that is 2+. Thank you for that.
Thank you.
Alright, so I will use my stethoscope now, the bell side, to check for the strength of your carotid artery. Once again, just to be sure.
Okay.
And if you could just face over there, that'd be great. Thank you. Just listening. Breathe in and breathe out normally. Good. And checking for 2+ on this side. And I'm also looking for swishing. Wonderful, we have 2+. The next thing I'm going to do is look over your thyroid. We're doing a full detailed lymph node check.
Okay.
Okay, and so the first one we're going to start off with is your pre-auricular. I'm just going to put the hair behind your ears. Is that
Okay, yep.
If you feel any pain at all during this process, please let me know.
Okay.
We're going to start with pre-auricular, which is right in front of the ears. I'm just going to softly palpate. Okay. We're going to go to the post-auricular, which is the back of the ear. The occipital, which is behind the head. The parotid, which is in the middle of the ear. The jugulo-digastric, which is right below the ear. The submandibular, which is right under the back of the jawline. Submental under front jawline. Superficial cervical, which is high neck. And we're going to go all the way down the deep cervical chain to the mid-lower neck and the clavicle. And we're going to go to the posterior cervical, which is the shoulder, and the supraclavicular, which is right by the clavicle. And I'm not feeling any bumps or deformities. Skin is warm to touch. Nothing standing out that looks to be of concern. Next, I'm going to check your capillary refill. I'll have you give me your left or your right hand, whichever one. I'm just checking for 2 seconds here. Wonderful. Now I'm going to look for skin tartar, and I'm going to pinch the skin.
Mm-hmm.
That's normal. That is normal. Okay, next I will look with my light at your hands for any deformities. I am not seeing any, which is wonderful. All right, and we'll go palms down. The hands look great. I don't even see any moles. You have like the perfect hands. Okay, awesome. Now I'm going to check for range of motion, and so I'm going to go up, down, back and forth. Good. Up, down, back and forth. Great. Now I'm going to take your arm here, and I'm going to palpate the brachial artery, which is found in the bend of the arms, and look for a 2+.
Okay.
2+, that is great. If we could just go like this. 2+. Now I'm looking for muscle strength. I'm going to have you squeeze my fingers as hard as you can. Perfect. Can you make an O with both your hands? Don't let me push my fingers through. Good. Go like this. Don't let me push back. Okay, good. Thank you so much. Put your hands down. Now what I'm going to have you do is just perfect hands up and down with your arms. Good. And go back to here. And what I'm going to do is check your muscles here. So don't let me push these out. Don't let me close. Good. Okay, thank you for that. The next thing we're going to do is a thorough chest inspection. First, I will look for abnormalities, lesions, wounds. So if you could just relax for me. Okay, I am not seeing any lesions. I am not seeing any wounds or anything to be concerned with. Great. I'll be using my stethoscope. We'll be looking for S1 and S2.
Okay.
Just breathe normal. Breathe in and out. Okay, good. Breathe in and out. Good. Now I'll be using my bell to look for any heart murmurs, swishing sounds of any kind. So I'll have you breathe in and out. Breathe in and out. Breathe in and out. Breathe in and out. All right, that looks really good. Now, I'm gonna check for crackling or wheezing in the lungs.
Okay.
What I'll have you do first off is I'll have you just let me know if the palpation or anything hurts.
Okay.
Okay, I'll do the front and then I'll do the back.
Okay.
All right, so just breathe normal. And I'll be using my bell. All right, everything sounds really good.
Okay.
I'm gonna have you turn around. So first off, I'll do palpation. Let me know if you feel any pain. Just breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. Good. I'll be using my stethoscope now. Okay, so can I have you breathe in deep and breathe in deep and again and again. Okay, and my bell. One more time. One more time. And again. And again. Okay, I'll have you just lift up your arm. I'll be listening to the side. Breathe in and out. Good. And the other side. So, okay. Okay, so I'm just going to make some notes here. No wheezing. No heart murmurs. Everything looks good. All right, so we're gonna move on to your lower extremities.
Okay.
Your legs. I'm gonna have you lay down.
Okay.
Is that okay?
Yep.
All right, so I'm gonna have you just lay down there. All right, so I'm gonna start off by just palpating your arm, bending it. Good. Same thing with this arm. Bend. Good. I'm just gonna palpate on your stomach. I want you to tell me if you feel pain. I'm just palpating your liver, your gallbladder. I'm just gonna feel for any lumps or bumps while I'm palpating. I'm just going to put slight pressure on your liver, okay, and your gallbladder. All right, breathe in. Good, breathe in. Good, I'm gonna check with my stethoscope for normal bowel sounds. I'll have you just breathe normal. And I'll be listening with my bell for any wheezing. Okay, everything sounds good in all 4 quadrants. Did you feel any pain while I was palpating? Mm-hmm. All right, we're gonna move on over to your legs.
Okay.
Okay, I'm just gonna feel your legs for any bumps or bruises.
Okay.
Alright, no bumps or bruises. Okay, I'm just going to check the capillary refill of your toes. looks good. Capillary refill. No bumps or bruises, nothing abnormal. Oh, everything looks wonderful. I'm going to take my light to your feet and make sure I don't see anything that I'm missing. Do you see a little scar here? Do you remember what happened?
I can't remember. I dropped an object on my foot and it kind of like, when it fell on it, it broke the skin. It kind of made a scar and started bleeding. But it was a while ago.
Like years ago?
Mm-hmm.
Okay. And you didn't get it stitched, no?
No.
Okay. All right. I like the tattoo on your foot there.
Thanks.
Super cute. Don't see anything abnormal. Okay. I'm going to look underneath your feet as well.
Okay.
Okay, I'm just going to move your foot this way and lift it up. Right, I don't see anything. Thank you. Lift this foot up and move it to the right. Okay, that looks really good. Perfect. Alright, everything seems to look great. I'm going to have you come back up. Alright, Shay, I am so glad that I was able to practice on you as a nurse.
Thank you.
I know a few times I didn't say the words like perfect, but as I am a nurse, you know, I'm learning, right? But as far as I'm concerned, everything looks really good from like a normal head to toe assessment. I don't see anything that we should be worried about.
Okay.
And I know you mentioned that blood clot earlier, so I want to just take a quick look at that.
Okay.
I'm going to have you talk to my doctor though.
Okay.
She's in the other room. But I'm going to just assess it myself so I can have the experience.
Okay.
And I'm going to take my light to it and I'm just going to palpate it. Okay, so I'm just going to feel around it. The skin is normal to touch. If I take a look with my light, I see that this is indeed a blood clot. And it looks like it should go away on its own. Does it hurt when I go like this?
Mm-mm.
Does it hurt when I directly press above it?
Mm-mm.
Okay, so this is definitely a lesion that will go away after a couple of days, according to my knowledge. But I'm going to have my doctor just double check it in the other room.
Okay.
Alright, so as far as that goes, you are in great shape. I am really glad that you came in.
Thank you.
Thank you for coming. And yeah, you can just go see her on the door to the right, okay?
Okay. All right. Thank you.
Thank you.